now like to talk a bit more about who's eligible for surgery, what type of procedures you can have, and why you would choose to have one particular operation or another, and why you would choose to have an operation with us. Generally speaking, people who are candidates for surgery must be heavy enough to get significant benefits from weight loss. When you're having an operation, you're taking a risk, and you've got to be able to justify this risk to yourself and to your families. The key thing is that you have to be motivated to change. You must gain something from weight loss other than just changing a number on the scales when you hop on them in the morning. There must be something driving you or pushing you to go through the weight loss process. When you have weight loss surgery, we're asking you to give away many freedoms with food that you've taken for granted. You won't do this unless you gain more from weight loss than you do from having chips or snacks or whatever your favourite comfort food is. It's obvious that you've got to be well enough to tolerate anaesthetic in the surgery, but most people generally are. All the operations we do work to reduce your appetite and slow down the speed that you eat. If you eat the wrong food, or you eat more than 3 times a day, this generally means that you are unwilling to make the important decisions about how you're going to approach food. And even though you're likely to lose weight for a while, sooner or later you'll gain weight. You cannot spend your entire life fighting your operation, because one day you'll learn how to beat it and you'll return to the eating habits that you have and your family have. And these eating habits made you overweight in the first place, and they will easily do so again. Learning new approaches to meal times is the only way to lose weight and sneak it off and keep it off. And it's very important to use the surgery as a way to do this. For quite some years we've offered more than one operation, mainly because I've strongly felt that not everybody is suitable for every operation. Operations affect people differently, and operations suit people differently depending on what they're trying to achieve and how they approach their food. Some of this I'd like to go through with the next few slides. The lap band, or the laparoscopic gastric band, is Australia's commonest weight loss operation. It's common because it's safe and it's effective. To date, there is no safer, effective weight loss treatment available. There are other weight loss treatments which are safer, such as pills and diets, but they're in the long term ineffective. There are other operations which are as effective or potentially more effective, but they're also significantly riskier. When somebody's thinking about weight loss surgery, the gastric band is a good place to start. And I'd usually encourage people to think about a band first and only move on to the other procedures if there's something about the band which doesn't suit them. Around about 50 to 60% of our patients will end up having gastric bands. It's a very effective operation with minimal downtime, but it does take months to work. It really is a procedure where we work like a personal trainer to train you how to eat properly. This is a great operation who want low risk. It's a great operation for people who can lose weight but have difficulty with weight regain. The laparoscopic sleeve gastrectomy is a newer operation. At St George Hospital we've been doing it for as long as anybody else in the country, and there's probably only a few centres in the world that have been doing it for longer than us. Despite these years of experience, there really isn't as much data available on its long-term effects. We know that it will be safe in the long term, but we don't know if it's going to be as effective as some of the other operations. We do this procedure by removing the distensible or compliant part of the stomach. So rather than being a large floppy sac that's able to accept a large amount of food, it's narrower and tighter, so the food you can fit in it is relatively low in volume. This is a good operation, but bad for people who struggle to manage complex food choices and routines, and people who are often too busy to plan and look after themselves. The one negative of it is that it's not a reversible procedure, unlike the other two. The laparoscopic gastric bypass is probably the worldwide gold standard for weight loss surgery. The gastric bypass has been done longer than any other current operation, and it's still the most common weight loss surgery in the world. It's a great operation for weight loss, but I think in a number of people it's probably stronger than what they need. And I don't really believe that you should have a large operation when a smaller operation will do just as well for you. But this is a great procedure for people wanting to get rid of bad diabetes, or people who have a lot of weight to lose and they want the strongest procedure that works for the longest amount of time. If you look at what effect the operation will have on you at the time of the surgery, you can see that the gastric band has you in hospital for 1 day or less, and most people are back to work within a week. It really does get you back to normal life very quickly. The sleeve and the gastric bypass have a similar amount of hospital stay and similar amount of time off work. With these operations, you start to lose weight quite quickly, and this can lead to significant fatigue, especially for the first 4 to 6 weeks. These are not the sort of operations that you should have if you've got a lot of things on your plate. It's obvious that all operations involve some risks. The risk of severe complications at the time of surgery with the gastric band are low, probably less than 1 in several thousand chance of very severe complications. When you have a gastric band, though, you're living with a mechanical device that must be carefully looked after and well maintained. And I think this is where a lot of problems turn up with gastric bands. There are a large number of individuals who have had gastric bands that haven't been well maintained, or the person with the band hasn't been back to see their doctors to have the device maintained. It's very clear that people who have bands that are over-tightened are at increased risks of band slippage and reflux, regurgitation and food intolerances. Certainly people who are under close follow-up have a very, very low risk of these problems, but people who disappear and don't return for follow-up can have quite high risks. If you look at groups of people who have had gastric band surgery, the reoperation rate is somewhere between 1 and 5% per year. Our reoperation rate is running a bit less than 1% per year, which is a good number. What this means is that the majority of people who we've put gastric bands on still have the procedure working 5, 6, 7 years down the track. Sleeve gastrectomy and Roux-en-Y gastric bypass have very similar operative complication rates. They have different long-term effects though. The sleeve has less risks of stomach-related complications but greater risks of reflux. These things balance out, and if you follow people for many years, there still is a reoperation rate. And in fact, there's a reoperation rate, as you can see, from all of the procedures. None of them are guaranteed to work. None of them work in everybody. And all of them require revision or modification in some people. So who should think about surgery? I think you should think about surgery if you're over 25 or 30 kilograms overweight, if you've got medical problems that are affecting your quality of life or your length of life, if you've failed diets and you're prepared to invest a bit of time into something that can work. I think you should consider surgery with us because we have one of the best safety records in the country. St George Hospital is one of the few hospitals in Australia that's been doing a large number of operations over a large number of years. We're one of the first centres that has systems making us eligible for the American system of accreditation for centres of excellence. What you should do if you're thinking about surgery is prepare yourself for a decision that's going to have lifelong consequences. You should ask yourself a few questions about what losing weight would mean to you and get some good information about surgery from reliable sources. Speak to somebody who's had surgery and ask them what it's like and ask them how they live with the operation. If you find somebody who's similar to you, who has a weight loss operation that they can cope with, then it will become obvious to you that you'd probably be able to cope with the same procedure. Because everybody's different, you won't be able to know what will suit you just based on a web seminar or a couple of brochures. Getting information that suits you is the most important thing. So when you come in for a talk, bring in a list of questions. We don't mind answering any of them. And we think that people who are well informed get better results and are easier to look after. Thank you very much for your time.